Good morning, everyone. When we think of flexibility, we think of terms such as being able to stretch, being flexible. The term is also associated with cheerleading, gymnastics, and things of such sort. But what is flexibility truly? Flexibility, as defined by NASM or the National Academy of Sports Medicine, is the normal extensibility in all soft tissues to allow for full range of motion in a joint. So, today, although it might look like I have a torture device and I'm going to beat kids with it, no, we're not going to beat kids with this. We are actually going to learn about SMR, which is self-myofascial release. Now, for those that don't know me, my name is Amber Boyd. I have been in the fitness industry for over 7 years, and I have the educational background of a corrective exercise specialist, which means I deal with injury prevention. One client of mine actually came to me. She was teaching a step class, and through a non-related ACL injury, it set her back because it started causing her more problems. So by using the flexibility continuum, she was able to come back to teaching step, which was her favorite thing to do, within only 4 weeks. Only 4 weeks of doing her flexibility. So today we will be discussing why we stretch, and stretching is not just flexibility; it goes beyond that. We will also learn how to do proper flexibility, how you can do them improperly, as well as learn how to gain more neuromuscular efficiency through the kinetic chain, which is using the whole body. Now, why do we stretch? Well, according to the National Academy of Sports Medicine, or NASM, research has shown that using proper flexibility techniques, we can decrease our risk or chance for muscle imbalances, joint dysfunctions, as well as overuse injuries. Now, overuse injuries are that repetitive movements that your joints are constantly taking hit for throughout the body. In fact, on sportsinjury.org, there was actually a story of a volleyball player who was complaining of shin splints or pain in her shins. And it was due to that repetitive movement that she was creating in her joints by doing all of that jumping motion constantly on a daily basis through practice. Through using the flexibility continuum, she was actually able to overcome the shin splint issue that she was dealing with. Another athlete to speak of would be like a baseball player, again found on the sportinjury.org site. A baseball player, such as a pitcher, doing that repetitive movement will also cause, for him, it was tennis elbow. And we've all experienced that as well. Tennis elbow is not just related to tennis. It is an overuse injury. So doing things in our everyday activities will actually inhibit us from doing the normal things that we would do. So he went through the flexibility continuum as well and saw relief from the tennis elbow. Did you know that 70% of all ACL injuries are actually related to non-contact sports? This means that about a third of you will actually exhibit some signs of ACL injury just doing everyday activities, such as stepping out of your car and stepping onto the curb the wrong way. 2 to 4 of you, because you're a female, 2 to 4 of you will actually receive an ACL injury throughout your life. Pretty astounding stats, right? Many times people don't look at flexibility in terms of an actual movement or a motion. We think of it as just a stretch, right? But in order to move properly through the kinetic chain is your body, we must have all areas working properly. If one area is affected, let's say the shins are giving you problems, one area is affected, you can guarantee that other areas will be affected as well. Okay, poor flexibility leads to the development of relative flexibility or incorrect flexibility. The body always chooses the path of least resistance. I have told you guys that so many times. It will always choose the easy way out in an exercise, no matter what it takes to do it. So I think Jack LaLanne kind of put it in perspective for us when he said, "Have you ever seen a lion stretch before making its attack?" More than likely not. No one's going to stop and stretch before they do something such as, let's say you're in a fiery burning building. Are you going to stop and think, okay, let me stretch before I take off out of here? No, it's not going to happen. So the body will always choose the easy way out. Okay. It is important to place movement on the body in different areas in all three planes of motion so that it can adapt to that environment. Now, if you take a look here at my board here, you'll see the injury cycle that we actually phase through. Everything starts out microscopically. It starts out on microscopic level, and that starts with our tissue trauma. So you don't know anything's going on in the body because it is so teeny tiny. Nothing is bothering you at that point. The next time that you start to feel pain is when we go through that cycle into the inflammation. That is your body's way, the pain response, kicking in and saying, whoa, okay, something's going on in here. So when you have shin splints, for example, this is when your shins are starting to hurt. It's inflamed inside the tissue in the muscle. The next phase in the cycle are the muscle spasms. Who's had a Charlie horse in the middle of the night? Those darn suckers, right? They really bother me during the night. But what is happening is that body is actually locked. That part of the body is locked down and it's not able to function properly, leading into the next phase, which is altered neuromuscular control. This is where that body chooses the easy way out, and it doesn't know how to properly function, so it creates the muscle imbalances, and it continues to go through that cycle until you do something about it. So let me go back to those adhesions for a minute. Throughout the muscle spasms, that is caused by these adhesions that are toxic waste dumped in your body. I know that sounds kind of nasty, right? But that's what happens. And in fact, it impairs your blood flow. When those knots are formed in there, the blood does not flow freely through your body. If you just stretch the muscle without working that adhesion or that knot out, what happens is you take a shoelace and it already has a knot in it and you pull by stretching it, you're actually making that knot tighter. It's not doing any good for you. So this is why we do what we call SMR, self-myofascial release, and this is my travel stick. You can also use what we call a foam roller, and I know some of you have those with you today. And you can work those knots out so that you get that full extensibility when you actually stretch. Okay, so it isn't for beating your kids. All right. Now, this is why it's an important concept in why we stretch. But there are 3 phases of proper flexibility, and the first phase is through static stretching. When we do static stretching, we're holding that muscle to the point of tension for about 20 to 30 seconds. And I'm going to demonstrate that for you right now. I'm going to take the hamstring stretch as an example. So what you would do is place one foot in front of the other and slightly turn the front foot inward. Can you guys see that? And you're going to come down like you're going to run a race. And then you're going to pull up to only the point of tension. So if it's right here, then you stay right there. If you can go further, then that's great, but you don't want to go any further than that point of tension because you're going to overstretch and then create that improper flexibility that we were talking about before. Hold it for 20 to 30 seconds, and that is your static stretching. You can do about 1 to 3 sets of those. Now, moving through the continuum of flexibility, you would go into what we call active stretching. That is phase 2. Active stretching or isolated stretching actually isolates that muscle in particular that you're trying to work. This is done more so in a repetition type form, so like you're actually doing an exercise versus just holding that stretch. If you have no postural distortions, meaning you have no muscle imbalances and nothing is going on with the body in other areas, then you can properly move through this phase. However, it doesn't hold much length to doing the active stretching, so it's not a necessity. You don't have to progress through this phase, but it is there in case you want to. The last phase of stretching is called dynamic stretching. Dynamic stretching is where we actually mimic or replicate movements that you do throughout a daily basis. So when I was saying stepping off of the curb, that's movement that you do in your everyday life. These little motions. So your body has to be prepared for those types of movements, and that's why we do dynamic stretching. Okay, so an example of the dynamic stretching would be like a multiplanar lunge, and you would move in all three planes of motion. There's three planes. The first plane is the sagittal plane, and this is the plane that we most often use throughout our everyday activities. We're always moving forward. But a multiplanar lunge is moving forward, moving to the side in the frontal plane, and then moving this way into a transverse plane. That's that movement that you make when you step out of the car. If you don't train properly and use these mimic exercises when you're doing your flexibility training, then you're optimally going to end up injured with all of those stats that we were talking about with the ACL injury. Okay, so in closing, flexibility is way more than just a stretch. Using proper flexibility and the tools to do so, properly phasing through the stretching technique is imperative to prevent injury so that you guys are optimally functioning through the kinetic chain. So, are you going to be a statistic of injury or prevention?